It has now been 3 weeks since Alberta's first case of COVID-19 was identified. To many Albertans, it probably feels like a lot more time has passed. Today, I want to talk about our efforts to slow this virus and what the next 3 weeks may hold. First, I will update you on today's numbers. We have confirmed 67 new cases of COVID-19 in Alberta. There have now been 486 cases identified in the province. We suspect that 34 of these cases may be community transmission, an increase of 1 from yesterday. Right now, 21 individuals are being treated in hospital, with 10 currently in the ICU. We have also learned that 13 symptomatic individuals from the Mackenzie long-term care facility have now tested positive, an increase of 8 from yesterday. They are self-isolating and receiving care. As of right now, there are no additional confirmed cases in the other continuing care and group home settings that I talked about yesterday. Today, I am pleased to share that we can confirm 27 Albertans have recovered from COVID-19, an increase of 24 from previously reported numbers. As I mentioned previously, we are working on streamlining the process for reporting recovered cases, and we expect that this number will increase in the coming days. We continue to confirm new cases in every zone and in all age groups. We are all being impacted by this virus. 3 weeks ago, I said that COVID-19 would test our health system. To date, our health system has responded remarkably to that test. While it is a privilege to be seen by Albertans as the face of this response, there are countless unsung heroes behind the scenes. For example, this time last month, our labs were completing only a handful of COVID-19 tests every day. They have increased their capacity to over 3,000 tests per day. Contact tracers in all zones are working tirelessly to make sure that anyone who is in contact with a confirmed case of COVID-19 is notified and knows to self-isolate. Alberta Health Services continues to make great strides to ensure our health system is resourced and ready to respond as the situation evolves. From HealthLink to assessment centres, from hospitals to home care, and all healthcare providers in the community, I want to express my heartfelt admiration for all healthcare professionals in this province who are working to respond to this virus. They are on the front lines, working countless hours in difficult circumstances to slow the spread and keep us safe. Of course, it's not just healthcare workers who are heroes in this response. Across Alberta, first responders, community leaders, social services workers, and workers in shelters for vulnerable Albertans, to name just a few, as well as custodians and cleaning staff in facilities that care for people in healthcare or other settings. All of these have undertaken tremendous work to support this response and to protect Albertans. From me and from every Albertan, I want to say thank you for all that you are doing to help keep us all safe and healthy. This virus has challenged us all, and so many have risen to that challenge with hope and resilience. Our system has responded with strength and ingenuity, but I want Albertans to understand there will be challenges coming in the next weeks. We have all seen what has occurred in countries like Italy and Spain. We are doing everything possible to prevent that from happening in Alberta by limiting the number of people who will need hospital care, by preventing the spread of this virus. We have cases in the community that we have not detected. So those 33 cases are the tip of the iceberg, and there are other people who we have not detected who are out in the community who have spread the disease, and there may be others who are continuing to spread it. So that is one thing that I would flag, is that we need to be really cautious about these numbers. They are only the portion that we have identified. The second thing I would say is that we have 10 people in the ICU right now with 486 cases of disease. So what we know is that that community transmission that is out there right now, that we're trying to get a better understanding of by the shift in our testing, that will drive even more cases in the ICU if we can't get a handle on this. And I want to remind everyone that we don't have a vaccine for this virus. There are treatments that are currently being investigated, but we don't have a clear single treatment that we know can cure this disease. And we know that many people who get it those especially who are older and have chronic health conditions, will get very sick and some of them will die. And so if we don't take action now, if we wait until we're in a situation where our hospitals are overwhelmed, it's too late. We have to take these actions now to prevent us from getting to that place. 3 weeks ago, our new normal became more real as we confirmed our first case. I know it has impacted every one of us. It will continue to do so, but we will rise to meet these new challenges in the days to come. As I've said before, we need to face this together and respond to this extraordinary crisis with extraordinary kindness. Continue to look out for each other and take care of yourselves. Your health is and always will be our top priority.